Okay, so let's unpack this. We've got some really fascinating sources today, and we're diving into this idea of ethical preparedness, especially with healthcare moving so fast, things like genomic medicine. What does it actually mean to be ethically prepared for something, well, so potentially transformative?
Yeah, it's a great question. And what's really key here, I think, is that ethical preparedness isn't just static rules. It's not a fixed checklist. The sources we looked at define it more as a kind of dynamic response. The
Yeah.
ability to actually spot and talk about ethical issues as they come up in real time.
Right, dynamic, not just rules on paper.
Exactly. And think about it, the pandemic made us think a lot about being prepared for bad stuff, unwanted events. But this is different. This is about innovations we want, things we're planning for, like genomics.
Welcome innovations, yeah.
But even though they promise amazing things, like diagnosing diseases earlier, they bring these really unique ethical challenges. It goes way beyond just, is it expensive or how do we explain it?
Okay, like what sort of challenges?
Well, for instance, genomic tests might show that social family ties and genetic ties don't quite line up like people thought.
Ah, okay, that could be difficult.
Definitely.
Yeah.
Or it might predict a disease that, well, you can't treat yet. And maybe the patient wouldn't even want to know that information. So it's not just a small tweak to how we do things. It demands this ongoing ethical problem solving.
That makes sense. It sounds much more involved than just, say, having an ethics committee review a proposal. How does this dynamic response actually look in practice? I mean, in a busy hospital or clinic.
Yeah, that's the crux of it. It has to go beyond those formal structures, the
Mm.
committees, the legal frameworks. It needs, as one source put it, a richer and more nuanced account. It's about building a kind of culture, really.
A culture.
Yeah, where asking ethical questions is normal, expected, like developing an ethical muscle, if you like.
Yeah.
There's a good example from UK, the Genetics Forum, started way back in 2001.
Okay, what do they do?
It's basically a group with people from different backgrounds, doctors, scientists, ethicists, and they get together and discuss really specific, tricky cases, the intricacies, as they say. They really value understanding the science, the clinical situation, and importantly, being willing to rethink ethical stances over time.
Rethink them.
Yes, and they even have this provocative idea about sometimes needing to be dangerously uncritical.
Dangerously uncritical. What does that mean?
It means questioning the routines, the things we just start doing without thinking to make sure we haven't become sort of ethically complacent. It helps people build confidence in handling these issues even when there isn't one clear right answer or, shared principles everyone agrees on.
I see. So it's about continuous reflection, not just rules. Okay, so if that's happening with practitioners, what about the bigger picture? The institutions, the NHS, for example.
Right. It's definitely a challenge at multiple levels, individual, institutional, national. Practitioners can't do this alone. They need support from their employers, from the whole healthcare system.
And that system is already under pressure.
Exactly.
Hmm.
Think about the NHS right now, all the challenges. Adding something complex like, say, nationwide newborn genomic screening,
Mm-hmm.
that adds a huge amount of moral labor, as the sources call it.
Mm.
And there are other concerns, too. People who donated their data for research are worried about genomics beyond health uses,
Meaning?
meaning their genetic data may be being used in ways they didn't strictly consent to, maybe other research, maybe even commercially. Navigating that, maintaining public trust, is incredibly delicate.
So connecting all this back, what does this mean for, well, for all of us, as this technology becomes more common?
Well, the big question really is whether the whole healthcare environment is truly ready for it. Is it set up to handle this? Because think about this. Your genomic sequence, once it's read, it's essentially immortal. It doesn't change.
Right, it stays with you for life.
But its meaning, its significance, that can shift and change in unpredictable ways over your lifetime. Maybe something found at birth only becomes relevant decades later when science advances or a treatment appears. So the ethical evaluation can't just be a one-off thing at the start. It has to be ongoing.
That really makes you stop and think, doesn't it? It's not just about whether the tech is ready, but are we as a society, as individuals, really ready to handle it?
Precisely. Fostering this ethical preparedness means we need space for real, honest discussion. We need to acknowledge the difficulties. One source warned that a disregarded and unprepared workforce may well prove to be the Achilles heel of even the best plans.
So the people involved are key.
Absolutely. An ethically prepared workforce, they'll be alert, they'll be concerned, naturally. But that alertness, that concern, it should be seen as a strength, an asset, not a danger. So as you hear about these amazing genomic advances, maybe the deeper question to ask yourself is, are we truly ready, not just for the science, but for the deep unfolding ethical journey that comes with having this immortal code?